Hello everyone, welcome to the Enlightened Civil Service Academy. Today we're going to analyze the editorial page of the Assam Tribune 2nd May 2021. Today we are going to discuss about the topic uh, why label COVID-19 as act of God. In this topic, the author is trying to criticize all the governments since independence for never never or take initiative for improving the health sector. We can say act of God is a natural hazard outside human control, and therefore the author is saying that we cannot connect the present pandemic situation to the act of God. Therefore, domino effect is a term which suitably fits the current COVID scenario in India. In a last year pandemic, social distancing backed by the strict lockdown had helped the country positively overcome the first phase of the outbreak. But the negligence of people and the governments led to the high number of cases due to second wave. Moreover, second wave shows the lack of governance where politics was given priority over people health by overcrowded and unmanaged political roadshow and public gathering during the election of the four state and one union territory. Moreover, free public movement was allowed mostly unscreened during election in four state and one union territory, which is the which is considered the topic as a main reason for the present scenario. Moreover, massive religious gatherings were also allowed by the government during the initial period of COVID second wave. As far as the India is concerned, India have a common notion of attaching failure as act of God. But COVID-19 or the novel coronavirus or SARS-CoV-2 is a part of severe acute respiratory syndrome virus family. The author is trying to say that the thing is the outbreak of the virus is not sudden nor unknown because its traces can be found um, in uh, in 2002 in the in the Guangdong provinces in China, and also a similar kind of virus was reported as MERS-CoV in the Middle East in 2012. But the writer is here trying to indicate about the health scenario, about the poor health scenario of India, which which is unable to fight, which is unable to prevent, and you know present rise of COVID-19 cases. A survey conducted by the Disease Dynamic Economic Policy Delhi in April 2020, India has only 1,38,530 hospital and 1 crore 22 lakhs 4,456 beds, which can be considered as 1% of the total population, that indicate that India has a poor health situation. When we closely observe about the union budget of 2021, which include majority of policy inclined towards recovery of losses and refueling the economy rather preventing of illness. So we can take the traces of negligence if we see The first 5-year plan, which started from 1951 to 56, when the allocation for health sector was only 3.33% of total budgetary allocation, when the scheme like National Malaria Control Program was initiated. But in 2020 budget, the allocation is again come down to 1.3% of total GDP. But however, the government of India in 2020, after the second wave, has raised this allocation to 137%. But as per the author, the it is little bit late to allocate the fund and utilize the fund in improving the health sector. Though India has successfully achieved many milestones in sectors like industry, service, etc., the second wave of COVID pandemic, which is spreading in the country at a faster rate than the first wave, has led to criticism over lack of due attention to the health sector in the last 7 decades, lack of proper research and development, over prioritizing politics over people. Again, another data is showing of global burden of disease study by the Lancet, India ranked 145 out of 195 countries in 2016. Another ranking of World Economic Forum Gender Gap Index 2019, India ranked 150. The 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 three prime factors for such poor performance in various health indices are poor performance in health sector, loophole in distribution of public health service, and least accessibility to affordable health service. Again, India's economy dropped at a faster rate after the first wave with a negative GDP, whereas some countries like China saw a faster recovery because country like China has prioritized people health with effective ground level management of the outbreak, immediate post disaster plan, research and development facilities, and government support the grassroots level industry, etc. Therefore, India can learn from all the economy that have successfully recovered from the worst scenario and are positively reviving their negative GDP by boosting research and development in the healthcare sector, adopting best health practices from around the world, effective surveillance of policy implementation, public direct benefit transfer system, inducting more workforce in health sector. In therefore, the author concluded with the thing that India's secular democratic outlook must shift focus on prevention of uncontrolled rise of COVID-19 cases by adopting the three-way coordination process among public, private and government. And also the writer is trying to say the government to prioritize people health over politics through cooperative federalism. Therefore, in this topic we have to learn that India have much to do for improving its health sector to the uh, fight the virus like COVID-19. Thank you. You can see the note in our Facebook page, that is Enlightened Civil Service Academy. Thank you.